NCLEX RN Challenge Exam. Questions free LPN practice test with answers for NCLEX PN Prep. Question 1. The nurse is caring for a 65-year-old male client with a history of ischemic heart disease who has been admitted to the ICU following a myocardial infarction. The client is currently receiving lidocaine IV to manage his ventricular ectopy. Which of the following factors would be most important for the nurse to consider in relation to the administration of this medication? Here are the options. Option A. Decrease in arterial oxygen saturation SaO2. Option B. Increase in systemic blood pressure. Option C. Presence of premature ventricular contractions PVCS. Option D. Observation of a widening QRS complex on the ECG. The correct answer is option D. Observation of a widening QRS complex on the ECG. A widening QRS complex on an ECG can indicate lidocaine toxicity or significant conduction delay, which is a critical safety consideration during administration. Question 2. A 72-year-old male patient with a history of atrial fibrillation and controlled hypertension has been initiated on warfarin therapy. The patient has a recent history of a peptic ulcer. Which instruction should the nurse prioritize when providing discharge teaching? Here are the options. Option A. Report incidents of diarrhea. Option B. Avoid foods high in vitamin K. Option C. Use a straight razor when shaving. Option D. Monitor for signs of bleeding, such as bruising or black tarry stools. The correct answer is option D. Monitor for signs of bleeding, such as bruising or black tarry stools. Warfarin increases the risk of bleeding. Given the history of peptic ulcers, monitoring for GI bleeds black tarry stools is the highest priority. Question 3. A nurse is preparing to insert an IV catheter for a 33-year-old patient who has a notably hairy forearm and is allergic to adhesives. How should the nurse manage excess hair at the intended catheter insertion site? Here are the options. Option A. Leaving the hair intact. Option B. Shaving the area. Option C. Clipping the hair in the area. Option D. Removing the hair with a depilatory. The correct answer is option C. Clipping the hair in the area. Clipping hair is preferred over shaving to prevent microabrasions that increase the risk of infection at the insertion site. Question 4. A nurse is educating an elderly female patient diagnosed with osteoporosis who leads a sedentary lifestyle. Which complication should the nurse emphasize as the most significant risk? Here are the options. Option A. Increase susceptibility to bone fractures. Option B. Consequences of long-term estrogen deficiency. Option C. Impact of sustained negative calcium balance. Option D. The progression of spinal deformities. The correct answer is option A. Increase susceptibility to bone fractures. The most significant clinical consequence of osteoporosis is the risk of fractures occurring from minimal trauma or daily activities. Question 5. What should the nurse identify as the primary goal for women performing regular breast self-examination BSE? Here are the options. Option A. To detect any cancerous lumps early. Option B. To identify areas of thickness or fullness. Option C. To notice any changes in the breast tissue from what is normal for each individual. Option D. To differentiate between fibrocystic masses and other lumps. The correct answer is option C. To notice any changes in the breast tissue from what is normal for each individual. The goal of BSc is for the individual to become familiar with their own normal so they can report any changes to a healthcare provider immediately. Question 6. A nurse is managing the care of a client diagnosed with hyperthyroidism reporting palpitations and weight loss. Which nursing intervention should be prioritized? Here are the options. Option A. Provide extra blankets to maintain warmth. Option B. Monitor for increased signs of restlessness, sweating, and weight loss. Option C. Encourage increased physical activity. Option D. Offer a low-iodine diet and coordinate with a dietitian. The correct answer is option B. Monitor for increased signs of restlessness, sweating, and weight loss. Hyperthyroidism involves hypermetabolism. Monitoring for worsening symptoms like extreme restlessness or weight loss helps identify potential thyroid storm. Question 7. A 55-year-old client has been diagnosed with atherosclerosis. Which of the following lifestyle modifications should the nurse emphasize? Here are the options. Option A. Focus on overall health rather than weight. Option B. Incremental increase in low-intensity exercise. Option C. Adherence to a heart-healthy diet low in saturated fats and cholesterol. Option D. Counseling on stress management techniques. The correct answer is option C. Adherence to a heart-healthy diet low in saturated fats and cholesterol. A diet low in saturated fats and cholesterol directly targets the primary cause of plaque buildup in atherosclerosis. Question 8. A client has undergone a laminectomy to relieve spinal cord compression. Which technique should the nurse use to reposition the client safely? Here are the options. Option A. Log roll the client carefully to maintain spinal alignment. Option B. Assist the client to dangle on the side of the bed. Option C. Encourage the client to use an overhead trapeze. Option D. Instruct the client to perform gentle range of motion exercises. The correct answer is option A. Log roll the client carefully to maintain spinal alignment. Log rolling ensures that the spine stays aligned as a single unit, preventing stress or injury to the surgical site. Question 9. A client who just had cataract removal is being prepared for discharge. Which of the following should be included in the discharge education? Here are the options. Option A. Restrict fluids to limit urination. Option B. Avoid lifting objects heavier than 5 lb 2.25 kg. Option C. Remain in a prone position while resting. Option D. Refrain from straining during bowel movements and avoid bending at the waist. The correct answer is option D. Refrain from straining during bowel movements and avoid bending at the waist. Straining and bending increase intraocular pressure, which can damage the surgical site or displace the new lens. Question 10. At what age should the nurse emphasize the initiation of regular testicular self-examinations? Here are the options. Option A. At the onset of sexual activity. Option B. After the age of 69. Option C. Starting after age 40. Option D. Prior to the age of 20. The correct answer is option D. Prior to the age of 20. Testicular cancer is the most common cancer in young men ages 15-35, so habits should be established before age 20. Question 11. A client's surgical wound site has suddenly dehisced, and there is evisceration. Which step should the nurse perform first? Here are the options. Option A. Promptly notify the surgeon. Option B. Immediately cover the eviscerated tissue with a sterile saline dressing. Option C. Check the client's vital signs. Option D. Attempt to gently approximate the wound edges. The correct answer is option B. Immediately cover the eviscerated tissue with a sterile saline dressing. Protecting the exposed organs with a sterile, moist dressing is the immediate priority to prevent tissue drying and infection. Question 12. The nurse observes a patient's respiratory cycle increasing and decreasing in depth and rate, with periods of apnea. This observation is most consistent with, here are the options. Option A. Progressively deeper breaths followed by shallower breaths with apneic periods. Option B. Rapid, deep breathing with abrupt pauses. Option C. Rapid, deep breathing without pauses. Option D. Shallow breathing with an increased respiratory rate. The correct answer is option A. Progressively deeper breaths followed by shallower breaths with apneic periods. This describes Cheyne-Stokes respirations, often seen in end-of-life care or severe brain injury. Question 13. Which type of breath sounds is the nurse most likely to auscultate that are typically associated with heart failure? Here are the options. Option A. Tracheal. Option B. Fine crackles. Option C. Coarse crackles. Option D. Friction rubs. The correct answer is option B. Fine crackles. Fine crackles are the classic auscultatory finding for pulmonary edema associated with left-sided heart failure. Question 14. A patient in an acute asthma exacerbation who is wheezing loudly suddenly has no audible breath sounds. What is the most likely explanation? Here are the options. Option A. The asthma attack has resolved. Option B. The airways are so constricted that air cannot pass through. Option C. The inflammation within the airways has subsided. Option D. Fine crackles have replaced the wheezes. The correct answer is option B. The airways are so constricted that air cannot pass through. A silent chest is a medical emergency indicating that air movement is insufficient to produce sound. Question 15. A patient begins to have a tonic-clonic seizure. During the active phase, which of the following actions should the nurse take? Here are the options. Option A. Insert a padded tongue depressor. Option B. Prepare to use a bite block. Option C. Restrain the limbs gently. Option D. Turn the patient to a side-lying position and protect the head. The correct answer is option D. Turn the patient to a side-lying position and protect the head. Turning the patient to the side prevents aspiration, and protecting the head prevents physical trauma during the seizure. Question 16. After chest tube insertion for pneumothorax, a client develops hypotension, neck vein distension, and tracheal shift. What cause should the nurse check for? Here are the options. Option A. Infection of the lung. Option B. Kinked or obstructed chest tube. Option C. Excessive water in the water seal chamber. Option D. Excessive chest tube drainage. The correct answer is option B. Kinked or obstructed chest tube. A kinked chest tube prevents air from escaping the pleural space, leading to a buildup of pressure and tension pneumothorax. Question 17. A patient with a history of stroke starts choking on food, but is coughing loudly and forcefully. What should the nurse do? Here are the options. Option A. Perform the abdominal thrust maneuver immediately. Option B. Perform back blows and chest thrusts. Option C. Exit the room to summon help. Option D. Stay with the patient and encourage him to keep coughing. The correct answer is option D. Stay with the patient and encourage him to keep coughing. If the patient is coughing forcefully, the airway is only partially obstructed. Encouraging coughing is the safest way to clear the object. Question 18. Which information would be most beneficial for the nurse to gather to tailor an individualized care plan for an 84-year-old with hypertension and mild cognitive impairment? Here are the options. Option A. General health overview of the last decade. Option B. Current health promotion activities like diet and exercise. Option C. Comprehensive family history of chronic diseases. Option D. The patient's marital status and living arrangements. The correct answer is option B. Current health promotion activities like diet and exercise. Knowing current habits allows the nurse to build on existing strengths and address specific deficits in the patient's daily routine. Question 19. To minimize the risk of aspiration during oral care for a comatose patient, what should the nurse do? Here are the options. Option A. Apply lemon glycerin swabs. Option B. Brush teeth while the patient is flat on her back. Option C. Position the patient in a side-lying position and lower the head of the bed. Option D. Use hydrogen peroxide to cleanse the mouth. The correct answer is option C. Position the patient in a side-lying position and lower the head of the bed. Side-lying position with the head lowered allows secretions to drain out of the mouth rather than into the trachea. Question 20. A dehydrated client with a change in mental status has a fever of 103 degrees F, yellow sputum, and pleuritic chest pain. The nurse suspects which condition? Here are the options. Option A. Adult respiratory distress syndrome ARDS. Option B. Myocardial infarction MI. Option C. Pneumonia. Option D. Tuberculosis. The correct answer is option C. Pneumonia. Fever, productive cough with yellow sputum, and pleuritic pain are classic indicators of pneumonia. Question 21. In a TB outbreak, which of these clients should the nurse prioritize for TB screening? Here are the options. Option A. 16-year-old with mild cough and fatigue. Option B. 33-year-old daycare worker with travel history. Option C. 43-year-old homeless man with alcohol use disorder, coughing up blood. Option D. 54-year-old businessman with weight loss. The correct answer is option C. 43-year-old homeless man with alcohol use disorder, coughing up blood. Homelessness, substance use, and hemoptysis coughing up blood are high-risk indicators for active TB. Question 22. A patient has a positive Mantoux test and night sweats. A chest X-ray is ordered. This diagnostic test is most crucial for which reason? Here are the options. Option A. To confirm the presence of active pulmonary tuberculosis. Option B. To determine if there is a need for a repeat Mantoux test. Option C. To assess the size and spread of any lesions within the lung tissue. Option D. To differentiate between primary and latent TB. The correct answer is option C. To assess the size and spread of any lesions within the lung tissue. While sputum culture confirms the diagnosis, the X-ray is crucial to visualize the extent of lung involvement and the presence of cavities. Question 23. A patient presents with an asthma exacerbation and reduced peak flow. Which medication class should the nurse anticipate administering first? Here are the options. Option A. Beta-adrenergic blockers. Option B. Bronchodilators. Option C. Inhaled steroids. Option D. Oral steroids. The correct answer is option B. Bronchodilators. Short-acting bronchodilators like albuterol are the first-line treatment to open the airways during an acute attack. Question 24. A patient presents with a persistent cough with thick sputum, lower extremity swelling, and blue-tinged nail beds with a 40-year smoking history. What is the most likely diagnosis? Here are the options. Option A. Adult respiratory distress syndrome ARDS. Option B. Asthma. Option C. Chronic obstructive bronchitis. Option D. Emphysema. The correct answer is option C. Chronic obstructive bronchitis. Chronic bronchitis is characterized by a productive cough, blue bloaters, and peripheral edema due to right-sided heart strain. Question 25. A postoperative embolectomy patient is refusing further surgery despite missing pulses. What is the nurse's initial response? Here are the options. Option A. Explain the risks of not having the surgery. Option B. Notify the physician immediately. Option C. Notify the nursing supervisor. Option D. Record the client's refusal in the notes. The correct answer is option B. Notify the physician immediately. The surgeon must be notified immediately of the change in vascular status and the patient's refusal, as this is a limb-threatening emergency. Question 26. During the endorsement, which of the following clients should the on-duty nurse assess first? Here are the options. Option A. 58-year-old with heart failure, BP 1 or 26 and 76. Option B. 89-year-old with end-stage heart failure DNR. Option C. 62-year-old with thrombophlebitis receiving heparin. Option D. 75-year-old with new-onset atrial fibrillation receiving diltiazem. The correct answer is option D. 75-year-old with new-onset atrial fibrillation receiving diltiazem. New-onset atrial fibrillation requires immediate assessment of hemodynamic stability and the response to the IV diltiazem. Question 27. A patient taking phenytoin dilantin for seizures presents for a follow-up. What is a common oral assessment finding for this medication? Here are the options. Option A. The gums appear enlarged and inflamed. Option B. The white blood cell count is low. Option C. Occasional missed doses. Option D. Patient wants to renew driver's license. The correct answer is option A. The gums appear enlarged and inflamed. Gingival hyperplasia, enlarged/inflamed gums, is a well-known side effect of long-term phenytoin use. Question 28. A child with Hirschsprung's disease presents with fever, explosive diarrhea, and abdominal distension. What is the priority action? Here are the options. Option A. Monitor the child every 30 minutes. Option B. Notify the physician immediately. Option C. Administer an antidiarrheal. Option D. Administer antipyretics for fever. The correct answer is option B. Notify the physician immediately. These are signs of Hirschsprung-associated enterocolitis HIC, a life-threatening complication that requires immediate medical intervention. Question 29. Which method is most appropriate for measuring the urine output of a 2-year-old toddler who is not toilet trained? Here are the options. Option A. Weighing the diaper. Option B. Insert Foley catheter. Option C. Ask the mother for number of changes. Option D. Compare intake with output. The correct answer is option A. Weighing the diaper. Weighing dry versus wet diapers 1G equals 1 ml is the standard non-invasive method for accurate output measurement in non-toilet trained children. Question 30. When planning care for an 8-year-old boy with Down syndrome, the nurse should. Here are the options. Option A. Plan according to the levels of a 5-year-old. Option B. Plan according to the level of a 7-year-old. Option C. Direct all teaching to the parents. Option D. Assess the child's current developmental level and plan care accordingly. The correct answer is option D. Assess the child's current developmental level and plan care accordingly. Children with Down syndrome have varying degrees of delay. Care must be individualized based on the specific child's current functional and developmental level. Question 31. The nurse is managing care for several clients in the outpatient clinic. Among the following clients who called, which one should the nurse prioritize in responding to first? Here are the options. Option A. A client with hepatitis reporting itching arms and legs. Option B. A client with a leg cast reporting a funny feeling in the leg. Option C. A client with osteomyelitis who is too nauseous to eat. Option D. A client with rheumatoid arthritis having trouble sleeping. The correct answer is option B. A client with a leg cast reporting a funny feeling in the leg. A funny feeling paresthesia in a limb with a cast can indicate neurovascular compromise or compartment syndrome, requiring immediate assessment. Question 32. A nurse on the surgical floor is prioritizing care after report. Which of the following patients should the nurse assess first? Here are the options. Option A. A patient with a gunshot wound and 1.5 cm of dark drainage. Option B. A mastectomy patient with 23 ml of serous sanguineous fluid in the JP drain. Option C. A patient with a collapsed lung and no chest tube drainage in 8 hours. Option D. A patient 3 days post-abdominal perineal resection reporting chills. The correct answer is option D. A patient 3 days post-abdominal perineal resection reporting chills. Chills in a postoperative patient can be an early sign of systemic infection or sepsis, requiring immediate intervention. Question 33. A nurse is monitoring a patient who underwent a thyroidectomy 12 hours ago. Which observation should concern the nurse most? Here are the options. Option A. The patient supports their head/neck when turning. Option B. The patient expresses difficulty swallowing liquids. Option C. The patient appears drowsy and has a sore throat. Option D. The patient shows involuntary flexion of the wrist when blood pressure is measured. The correct answer is option D. The patient shows involuntary flexion of the wrist when blood pressure is measured. Involuntary flexion of the wrist trousseau sign indicates hypocalcemia, a serious complication if the parathyroid glands were damaged or removed. Question 34. A patient is admitted with suspected appendicitis. Which of the following actions should the nurse prioritize for pain relief? Here are the options. Option A. Encourage the patient to change positions frequently. Option B. Apply warmth to the abdomen with a heating pad. Option C. Use comfort measures and pillows to position the patient comfortably. Option D. Administer an antiemetic as prescribed. The correct answer is option C. Use comfort measures and pillows to position the patient comfortably. For appendicitis, heat is contraindicated as it can cause rupture. Comfort positioning, often side-lying with knees flexed, is the safest initial intervention. Question 35. A patient is preparing for their first peritoneal dialysis session. Which of the following actions should the nurse prioritize? Here are the options. Option A. Assess for a bruit and a thrill. Option B. Warm the dialysate solution. Option C. Position the client on the left side. Option D. Insert a Foley catheter. The correct answer is option B. Warm the dialysate solution. Warming the dialysate to body temperature prevents abdominal cramping and causes vasodilation, which improves the efficiency of the exchange. Question 36. A patient with right-sided hemiplegia is learning to use a cane. Which behavior indicates that teaching was effective? Here are the options. Option A. Holds cane in right hand, moves cane then right leg then left leg. Option B. Holds cane in right hand, moves cane then left leg then right leg. Option C. Holds cane in left hand, moves cane then right leg then left leg. Option D. Holds cane in left hand, moves cane then left leg then right leg. The correct answer is option C. Holds cane in left hand, moves cane then right leg then left leg. A cane should be held on the strong side left. The cane and the weak leg right should advance together to provide support. Question 37. An 82-year-old with Parkinson's and mild cognitive impairment is admitted. Which action is most appropriate to promote safety and comfort? Here are the options. Option A. Ask the family to provide personal items like photos. Option B. Select a room with the bed by the door to look down the hall. Option C. Suggest the woman eat her meals in the room with her roommate. Option D. Encourage the woman to ambulate in the halls twice a day. The correct answer is option A. Ask the family to provide personal items like photos. Personal items and photos help orient a cognitively impaired patient to their environment, reducing confusion and anxiety. Question 38. A patient with a recent hip replacement is learning to use a walker. Which behavior indicates teaching was effective? Here are the options. Option A. Slowly pushes the walker forward 12 inches, then takes small steps. Option B. Lifts the walker, moves it forward 10 inches, then takes small steps. Option C. Supports weight on the walker while advancing it forward. Option D. Slides the walker 18 inches forward, then takes small steps. The correct answer is option B. Lifts the walker, moves it forward 10 inches, then takes small steps. Standard walkers without wheels should be lifted and moved forward before the patient takes steps to ensure a stable base of support. Question 39. Which of the following reasons is most likely to increase the risk of sensory deprivation in an elderly group? Here are the options. Option A. Increased sensitivity to medication side effects. Option B. Decreased visual, auditory, and gustatory abilities. Option C. Isolation from families and familiar surroundings. Option D. Decrease in musculoskeletal function and mobility. The correct answer is option B. Decreased visual, auditory, and gustatory abilities. Loss of sensory input through sight, hearing, and taste directly leads to sensory deprivation in the elderly. Question 40. A patient with emphysema presents with increasing restlessness and confusion. What step should the nurse take next? Here are the options. Option A. Encourage the client to perform pursed lip breathing. Option B. Check the client's temperature. Option C. Assess the client's potassium level. Option D. Increase the client's oxygen flow rate. The correct answer is option A. Encourage the client to perform pursed lip breathing. Restlessness and confusion in cough suggest CO2 retention or hypoxia. Pursed lip breathing helps the patient exhale trapped air and improve oxygenation. Question 41. A patient who recently underwent a kidney transplant is being monitored. Which assessment would strongly prompt the nurse to suspect organ rejection? Here are the options. Option A. Sudden weight loss. Option B. Polyuria. Option C. Hypertension. Option D. Shock. The correct answer is option C. Hypertension. Hypertension, along with fever and tenderness over the graft site, is a classic sign of acute kidney transplant rejection. Question 42. What should be the immediate objective of nursing care for a patient with ureteral colic? Here are the options. Option A. Decrease pain. Option B. Decrease weight. Option C. Decrease hematuria. Option D. Increase fluid intake. The correct answer is option A. Decrease pain. Ureteral colic causes excruciating pain. Managing the patient's pain is the highest priority before addressing other symptoms. Question 43. What is the primary reason for administering Lugol's iodine solution to a patient before a subtotal thyroidectomy? Here are the options. Option A. Decrease the total basal metabolic rate. Option B. Maintain the function of the parathyroid glands. Option C. Block the formation of thyroxine by the thyroid gland. Option D. Decrease the size and vascularity of the thyroid gland. The correct answer is option D. Decrease the size and vascularity of the thyroid gland. Iodine solutions Lugols are used preoperatively to reduce the vascularity of the thyroid gland, thereby reducing the risk of hemorrhage during surgery. Question 44. Which of the following conditions can also lead to acute hypoglycemia? Here are the options. Option A. Liver disease. Option B. Hypertension. Option C. Type 2 diabetes. Option D. Hyperthyroidism. The correct answer is option A. Liver disease. The liver stores glycogen. Liver disease can impair the body's ability to release glucose, leading to hypoglycemia. Question 45. Which systemic side effect should the nurse monitor for in a patient receiving chemotherapy for metastatic carcinoma? Here are the options. Option A. Ascites. Option B. Nystagmus. Option C. Leukopenia. Option D. Polycythemia. The correct answer is option C. Leukopenia. Chemotherapy causes bone marrow suppression, with leukopenia, low white blood cell count, being a common and dangerous systemic side effect. Question 46. What should the nurse suggest to a colostomy patient to help control the passage of gas? Here are the options. Option A. Eliminate foods high in cellulose. Option B. Decrease fluid intake at mealtimes. Option C. Avoid foods that in the past caused flatus. Option D. Adhere to a bland diet prior to social events. The correct answer is option C. Avoid foods that in the past caused flatus. Gas production is highly individualized. Avoiding specific foods that the patient knows cause gas is the most effective management strategy. Question 47. Which statement by the patient indicates that instructions for colostomy irrigation have been understood? Here are the options. Option A. I should lie on my left side while instilling the solution. Option B. I should keep the irrigating container less than 18 inches above the stoma. Option C. I should instill a minimum of 1,200 ml of solution. Option D. I should insert the catheter deeper if cramping occurs. The correct answer is option B. I should keep the irrigating container less than 18 inches above the stoma. The irrigation bag should be hung no higher than 18 inches to prevent the solution from flowing too quickly, which causes cramping. Question 48. Which intervention is part of the prescribed therapy to correct electrolyte imbalance in a patient in the oliguric phase of acute tubular necrosis? Here are the options. Option A. Administer K-oxalate. Option B. Restrict foods high in protein. Option C. Increase oral intake of cheese and milk. Option D. Administer large amounts of normal saline via IV. The correct answer is option A. Administer K-oxalate. In the oliguric phase, hyperkalemia is common. K-oxalate sodium polystyrene sulfonate is used to remove excess potassium from the body. Question 49. The physician orders 2 liters of Roman IV fluid to be administered Q12H. The drop factor is 10 GTT/ml. The nurse should set the flow to. Here are the options. Option A. 18 GTT/min. Option B. 28 GTT/min. Option C. 32 GTT/min. Option D. 36 GTT/min. The correct answer is option B. 28 GTT/min. Calculation. 2000 ml * 10 GTT/12 hours * 60 min equals 20 thuds. 720 equals 27.7. Rounding to 28 GTT/min. Question 50. According to the rule of nines, which area has the largest percent of burns in this patient? Here are the options. Option A, face and neck. Option B, right upper arm and penis. Option C, right thigh and penis. Option D, upper trunk. The correct answer is option D, upper trunk. The upper trunk anterior represents 9%, or the entire anterior trunk represents 18%, making it larger than the individual arm or head percentages. Question 51. An unconscious patient is brought in after a fall from a 2-story building. Which assessment finding should the nurse be most concerned about? Here are the options. Option A, reactive pupils. Option B, a depressed fontanelle. Option C, bleeding from ears. Option D, an elevated temperature. The correct answer is option C, bleeding from ears. Bleeding or cerebrospinal fluid leakage from the ears arteria is a sign of a basilar skull fracture, a critical emergency. Question 52. Which piece of information indicates a knowledge deficit regarding the management of a cardiac pacemaker? Here are the options. Option A, take your pulse rate once a day in the morning. Option B, maintain a safe distance from high-powered electrical devices. Option C, regular follow-up care is important. Option D, you may engage in contact sports. The correct answer is option D, you may engage in contact sports. Patients with pacemakers must avoid contact sports to prevent damage to the device or dislodging the pacemaker leads. Question 53. Which statement reflects the most relevant knowledge about oxygen administration to a patient with COPD? Here are the options. Option A, oxygen at 1-2 L/min is given to maintain the hypoxic stimulus. Option B, hypoxia stimulates central chemoreceptors in the medulla. Option C, oxygen is administered best using a non-rebreathing mask. Option D, blood gases are monitored using a pulse oximeter. The correct answer is option A. Oxygen at 1-2 L/min is given to maintain the hypoxic stimulus. In some COPD patients, the drive to breathe is triggered by low oxygen levels hypoxia. Excessive oxygen can suppress this respiratory drive. Question 54. Placing a post-pneumonectomy patient in Fowler's position on either his right side or back primarily. Here are the options. Option A, reduces incisional pain. Option B, facilitates ventilation of the left lung. Option C, equalizes pressure in the pleural space. Option D, increases venous return. The correct answer is option B, facilitates ventilation of the left lung. Positioning the patient on the operative side or back allows the remaining lung, in this case, the left, to expand fully and maximize ventilation. Question 55. In teaching a patient what to expect after bronchoscopy, what is the highest priority information? Here are the options. Option A, food and fluids will be withheld for at least 2 hours. Option B, warm saline gargles will be done every 2 hours. Option C, coughing and deep breathing exercises will be done every 2 hours. Option D, only ice chips and cold liquids will be allowed initially. The correct answer is option A. Food and fluids will be withheld for at least 2 hours. Following a bronchoscopy, the gag reflex is suppressed by anesthesia. Food and fluids must be withheld until the reflex returns to prevent aspiration. Question 56. For which condition should the nurse expect hypertonic glucose insulin infusions and sodium bicarbonate to be used? Here are the options. Option A, hypernatremia. Option B, hypokalemia. Option C, hyperkalemia. Option D, hypercalcemia. The correct answer is option C, hyperkalemia. Insulin and glucose work together to shift potassium from the extracellular fluid into the cells, rapidly lowering serum potassium levels. Question 57. Which statement by the nurse is most appropriate for a patient diagnosed with condylomata acuminata genital warts? Here are the options. Option A. This condition increases your risk for cervical cancer. Option B. The usual treatment for this is metronidazole flagyl. Option C. Using condoms completely eliminates the risk of transmission. Option D. HPV cannot be transmitted during oral sex. The correct answer is option A. This condition increases your risk for cervical cancer. Condylomata acuminata is caused by HPV, which is strongly linked to the development of cervical cancer. Regular Pap smears are essential. Question 58. Regarding the anatomy of the kidneys, which of the following is true? Here are the options. Option A. The left kidney usually is slightly higher than the right one. Option B. The kidneys are situated just above the adrenal glands. Option C. The average kidney is 5 cm long and 2 cm wide. Option D. The kidneys lie between the 10th and 12th thoracic vertebrae. The correct answer is option A. The left kidney usually is slightly higher than the right one. The right kidney is usually slightly lower than the left because it is displaced downward by the liver. Question 59. Which laboratory test result is most consistent with a diagnosis of chronic renal failure (CRF)? Here are the options. Option A. Increased pH with decreased hydrogen ions. Option B. Increased serum levels of potassium, magnesium, and calcium. Option C. BUN 100 mg/dl and serum creatinine 6.5 mg/dl. Option D. Uric acid analysis 3.5 mg/dl and PSP excretion 75%. The correct answer is option C. BUN 100 mg/dl and serum creatinine 6.5 mg/dl. CRF is characterized by the accumulation of nitrogenous waste, resulting in significantly elevated BUN and creatinine levels. Question 60. The nurse should provide which definition of dysplasia? Here are the options. Option A. Presence of undifferentiated tumor cells. Option B. Increase in the number of normal cells. Option C. Replacement of one cell type by another type. Option D. Alteration in the size, shape, and organization of cells. The correct answer is option D. Alteration in the size, shape, and organization of cells. Dysplasia refers to abnormal development or growth of cells, characterized by changes in size, shape, and appearance, often a precursor to cancer. Question 61. The nurse is aware that the following terms used to describe reduced cardiac output and perfusion impairment due to ineffective pumping of the heart is. Here are the options. Option A. Anaphylactic shock. Option B. Cardiogenic shock. Option C. Distributive shock. Option D. myocardial infarction MI. The correct answer is option B, cardiogenic shock. Cardiogenic shock occurs when the heart's ability to pump blood is severely impaired, leading to reduced cardiac output and systemic tissue hypoperfusion. Question 62. A client with hypertension asks the nurse which factors can cause blood pressure to drop to normal levels. Here are the options. Option A, kidneys excretion to sodium only. Option B, kidneys retention of sodium and water. Option C, kidneys excretion of sodium and water. Option D, kidneys retention of sodium and excretion of water. The correct answer is option C, kidneys excretion of sodium and water. The kidneys regulate blood pressure by managing fluid volume. Excreting excess sodium and water reduces blood volume and pressure. Question 63. Nurse Rose is aware that the statement that best explains why furosemide Lasix is administered to treat hypertension is. Here are the options. Option A, it dilates peripheral blood vessels. Option B, it decreases sympathetic cardioacceleration. Option C, it inhibits the angiotensin-converting enzymes. Option D, it inhibits the reabsorption of sodium and water in the loop of Henle. The correct answer is option D. It inhibits the reabsorption of sodium and water in the loop of Henle. Furosemide is a loop diuretic that inhibits sodium and water reabsorption in the loop of Henle, leading to diuresis and decreased blood pressure. Question 64. Nurse Nikki knows that laboratory results supports the diagnosis of systemic lupus erythematosus, SLE is. Here are the options. Option A, elevated serum complement level. Option B, thrombocytosis, elevated sedimentation rate. Option C, pancytopenia, elevated antinuclear antibody ANA titer. Option D, leukocytosis, elevated blood urea nitrogen BUN and creatinine levels. The correct answer is option C, pancytopenia, elevated antinuclear antibody ANA titer. SLE is characterized by pancytopenia, low RBC, WBC, and platelets and high ANA titers, which are hallmark diagnostic markers. Question 65. Arnold, a 9-year-old client with a mild concussion, complains of a severe headache. Which of the following responses by the nurse is appropriate regarding pain relief? Here are the options. Option A, acetaminophen is strong enough. Option B, aspirin is avoided because of the danger of Ray's syndrome. Option C, narcotics are avoided after a head injury because they may hide a worsening condition. Option D, stronger medications may lead to vomiting. The correct answer is option C. Narcotics are avoided after a head injury because they may hide a worsening condition. Narcotics are avoided after head injuries because they can cause sedation and pupillary changes that mask signs of deteriorating neurologic status. Question 66. When evaluating an arterial blood gas from a male client with a subdural hematoma, the nurse notes the PaCO2 is 30 mmHg. Which response describes the result? Here are the options. Option A, appropriate. Lowering carbon dioxide CO2 reduces intracranial pressure ICP. Option B, emergent. The client is poorly oxygenated. Option C, normal. Option D, significant. The client has alveolar hypoventilation. The correct answer is option A. Appropriate. Lowering carbon dioxide CO2 reduces intracranial pressure ICP. Lowering PA CO2 hypocapnia causes cerebral vasoconstriction, which helps reduce intracranial volume and pressure in patients with head injuries. Question 67. When prioritizing care, which of the following clients should the nurse Olivia assess first? Here are the options. Option A. A 17-year-old client 24 hours post-appendectomy. Option B. A 33-year-old client with a recent diagnosis of Guillain-Barré syndrome. Option C. A 50-year-old client 3 days post-myocardial infarction. Option D. A 50-year-old client with diverticulitis. The correct answer is option B. A 33-year-old client with a recent diagnosis of Guillain-Barré syndrome. Guillain-Barré syndrome can lead to rapid ascending paralysis affecting respiratory muscles. These patients require frequent monitoring for airway stability. Question 68. JP has been diagnosed with gout and wants to know why colchicine is used in the treatment. Which action explains why it's effective? Here are the options. Option A. Replaces estrogen. Option B. Decreases infection. Option C. Decreases inflammation. Option D. Decreases bone demineralization. The correct answer is option C. Decreases inflammation. Colchicine is an anti-inflammatory medication specifically used to reduce the pain and inflammation associated with acute gout attacks. Question 69. Norma asks for information about osteoarthritis. Which of the following statements about osteoarthritis is correct? Here are the options. Option A. Osteoarthritis is rarely debilitating. Option B. Osteoarthritis is a rare form of arthritis. Option C. Osteoarthritis is the most common form of arthritis. Option D. Osteoarthritis only affects people over 60. The correct answer is option C. Osteoarthritis is the most common form of arthritis. Osteoarthritis is the most common form of arthritis worldwide, characterized by the progressive breakdown of joint cartilage. Question 70. Ruby is receiving thyroid replacement therapy and forgets to take her medicine while sick with the flu. This puts the client at risk for which complication? Here are the options. Option A. Exophthalmos. Option B. Thyroid storm. Option C. Myxedema coma. Option D. Tibial myxedema. The correct answer is option C. Myxedema coma. Myxedema coma is the life-threatening extreme of hypothyroidism, often triggered by stopping replacement therapy or by systemic stressors like infection. Question 71. Nurse Sugar is assessing a client with Cushing's syndrome. Which observation should the nurse report to the physician first? Here are the options. Option A. Pitting edema of the legs. Option B. An irregular apical pulse. Option C. Dry mucous membranes. Option D. Frequent urination. The correct answer is option B. An irregular apical pulse. Cushing's often involves hypokalemia. An irregular pulse could indicate a dangerous cardiac arrhythmia caused by electrolyte imbalances. Question 72. A client with severe head trauma has urine output rise above 200 ml/hour. Which laboratory findings support the suspicion of diabetes insipidus? Here are the options. Option A. Above normal urine and serum osmolality. Option B. Below normal urine and serum osmolality. Option C. Above normal urine osmolality, below normal serum osmolality. Option D. Below normal urine osmolality, above normal serum osmolality. The correct answer is option D. Below normal urine osmolality, above normal serum osmolality. In DIE, the lack of ADH leads to the excretion of large amounts of dilute urine low osmolality and concentrated blood high serum osmolality. Question 73. Which statement indicates that a client with hyperosmolar hyperglycemic noncatotic syndrome (HHNS) understands her condition? Here are the options. Option A. I can avoid getting sick by not becoming dehydrated and paying attention to urination and thirst. Option B. If I experience trembling, I should drink soda. Option C. I will notify the physician if my blood glucose is constantly elevated. Option D. If I feel hungry, I'll eat a snack high in carbohydrates. The correct answer is option A. I can avoid getting sick by not becoming dehydrated and paying attention to urination and thirst. HHNS is often triggered by dehydration. Patients must understand the importance of hydration and monitoring for polyuria and polydipsia. Question 74. A 66-year-old client complains of sleeping more, anorexia, weakness, irritability, and bone pain. The nurse would suspect which disorder? Here are the options. Option A. Diabetes mellitus. Option B. Diabetes insipidus. Option C. Hypoparathyroidism. Option D. Hyperparathyroidism. The correct answer is option D. Hyperparathyroidism. Hyperparathyroidism leads to hypercalcemia, which presents with symptoms like anorexia, bone pain, fatigue, and polyuria. Question 75. Nurse Lourdes is teaching a client recovering from Addisonian crisis about hydrocortisone. Which statement indicates understanding? Here are the options. Option A. I'll take my hydrocortisone in the late afternoon. Option B. I'll take all of my hydrocortisone in the morning. Option C. I'll take 2/3 of the dose when I wake up and 1/3 in the late afternoon. Option D. I'll take the entire dose at bedtime. The correct answer is option C. I'll take 2/3 of the dose when I wake up and 1/3 in the late afternoon. Steroid replacement therapy typically follows the natural circadian rhythm of cortisol secretion, which is highest in the morning. Question 76. Which laboratory test result suggests a client has a corticotropin-secreting pituitary adenoma? Here are the options. Option A. High corticotropin and low cortisol levels. Option B. Low corticotropin and high cortisol levels. Option C. High corticotropin and high cortisol levels. Option D. Low corticotropin and low cortisol levels. The correct answer is option C. High corticotropin and high cortisol levels. An ACE-secreting adenoma causes the adrenal glands to overproduce cortisol, resulting in high levels of both ACE and cortisol. Question 77. A client is scheduled for a transphenytal hypophysectomy. Preoperatively, the nurse should assess for potential complications by. Here are the options. Option A. Testing for ketones in the urine. Option B. Testing urine-specific gravity. Option C. checking temperature every 4 hours. Option D, performing capillary glucose testing every 4 hours. The correct answer is option B, testing urine-specific gravity. Pituitary surgery carries a high risk of diabetes insipidus. Monitoring urine-specific gravity is essential to detect fluid balance changes. Question 78. Regular insulin is administered at 2 p.m. for a glucose level of 250 mg/dl. When should the nurse expect the peak effect? Here are the options. Option A, onset at 2 p.m. and peak at 3 p.m. Option B, onset at 2:15 p.m. and peak at 3 p.m. Option C, onset at 2:30 p.m. and peak at 4 p.m. Option D, onset at 4 p.m. and peak at 6 p.m. The correct answer is option C, onset at 2:30 p.m. and peak at 4 p.m. Regular insulin short-acting typically has an onset of 30 to 60 minutes and reaches its peak effect between 2 to 4 hours after administration. Question 79. Which test result would confirm the diagnosis of hyperthyroidism? Here are the options. Option A, no increase in TSH during a TSH stimulation test. Option B, a decreased TSH level. Option C, an increase in TSH after 30 minutes. Option D, below normal levels of serum T3 and T4. The correct answer is option B, a decreased TSH level. In primary hyperthyroidism, high levels of circulating T3 and T4 suppress the pituitary gland, resulting in a low TSH level. Question 80. When teaching a client how to rotate insulin injection sites, which instruction is correct? Here are the options. Option A, inject insulin into healthy tissue with large blood vessels. Option B, rotate injection sites within the same anatomic region. Option C, administer insulin into scar tissue or hypertrophy. Option D, administer insulin into sites above muscles you plan to exercise. The correct answer is option B, rotate injection sites within the same anatomic region. Rotating within the same anatomic region, for example, different spots on the abdomen, helps maintain consistent insulin absorption rates. Question 81. Nurse Sarah expects an elevated serum glucose in HHNS. Which other laboratory finding should the nurse anticipate? Here are the options. Option A, elevated serum acetone level. Option B, serum ketone bodies. Option C, serum alkalosis. Option D, below normal serum potassium level. The correct answer is option D, below normal serum potassium level. HHNS involves profound osmotic diuresis leading to total body potassium depletion through urinary loss. Question 82. For a client with Graves' disease, which nursing intervention promotes comfort? Here are the options. Option A, restricting intake of oral fluids. Option B, placing extra blankets on the client's bed. Option C, limiting intake of high carbohydrate foods. Option D, maintaining room temperature in the low normal range. The correct answer is option D, maintaining room temperature in the low normal range. Hyperthyroidism causes heat intolerance due to a hypermetabolic state. Keeping the room cool directly promotes patient comfort. Question 83. Patrick is treated in the emergency department for a Colles fracture. What is a Colles fracture? Here are the options. Option A. Fracture of the distal radius. Option B. Fracture of the olecranon. Option C. Fracture of the humerus. Option D. Fracture of the carpal scaphoid. The correct answer is option A. Fracture of the distal radius. A Colles fracture is a common fracture of the distal radius at the wrist, usually caused by falling on an outstretched hand. Question 84. Cleo is diagnosed with osteoporosis. Which electrolytes are involved in the development of this disorder? Here are the options. Option A. Calcium and sodium. Option B. Calcium and phosphorus. Option C. Phosphorus and potassium. Option D. Potassium and sodium. The correct answer is option B. Calcium and phosphorus. Osteoporosis involves the loss of bone density, which is primarily regulated by the balance of calcium and phosphorus. Question 85. A firefighter treated for smoke inhalation develops severe hypoxia 48 hours after the incident. What condition has likely developed? Here are the options. Option A. Adult respiratory distress syndrome ARDS. Option B. Atelectasis. Option C. Bronchitis. Option D. Pneumonia. The correct answer is option A. Adult respiratory distress syndrome ARDS. ARDS is a common and severe complication that occurs 24-48 hours after lung insult, such as smoke inhalation or trauma. Question 86. A client develops acute shortness of breath and hypoxia following a right femur fracture. What is the most likely cause? Here are the options. Option A. Asthma attack. Option B. Atelectasis. Option C. Bronchitis. Option D. Fat embolism. The correct answer is option D. Fat embolism. Fat embolism syndrome is a critical risk following long bone fractures and typically presents with sudden respiratory distress and hypoxia. Question 87. A client has decreased to absent breath sounds on the right side, from the apex to the base. Which condition explains this? Here are the options. Option A. Acute asthma. Option B. Chronic bronchitis. Option C. Pneumonia. Option D. Spontaneous pneumothorax. The correct answer is option D. Spontaneous pneumothorax. A pneumothorax involves air in the pleural space causing lung collapse, resulting in absent breath sounds on the affected side. Question 88. Following a motor vehicle accident, a driver has difficulty breathing and no breath sounds in the upper lung lobe. What is the likely diagnosis? Here are the options. Option A. Bronchitis. Option B. Pneumonia. Option C. Pneumothorax. Option D. Tuberculosis TB. The correct answer is option C. Pneumothorax. Trauma from a car accident frequently results in a pneumothorax due to blunt force or rib fractures piercing the lung tissue. Question 89. If a client requires a pneumonectomy, what fills the area of the thoracic cavity? Here are the options. Option A. The space remains filled with air only. Option B. The surgeon fills the space with a gel. Option C. Serous fluids fill the space and consolidate the region. Option D. The tissue from the other lung grows over. The correct answer is option C. Serous fluids fill the space and consolidate the region. After a lung is removed, the empty space fills with serous fluid which eventually consolidates into fibrous tissue. Question 90. Hemoptysis may be present in the client with a pulmonary embolism because of. Here are the options. Option A. Alveolar damage in the infarcted area. Option B. Involvement of major blood vessels in the occluded area. Option C. Loss of lung parenchyma. Option D. Loss of lung tissue. The correct answer is option A. Alveolar damage in the infarcted area. In a P, lung tissue can become infarcted. As alveoli are damaged, blood may leak into the airways and be expectorated hemoptysis. Question 91. When giving intravenous IV phenytoin, which of the following methods should you use? Here are the options. Option A. Use an inline filter. Option B. Withhold other anticonvulsants. Option C. Mix the drug with saline solution only. Option D. Flush the IV catheter with dextrose solution. The correct answer is option C. Mix the drug with saline solution only. Phenytoin is highly unstable and will precipitate if mixed with any solution other than 0.9% normal saline. Question 92. After surgical repair of a hip, which of the following positions is best for the patient's legs and hips? Here are the options. Option A. Abduction. Option B. Adduction. Option C. Prone. Option D. Subluxated. The correct answer is option A. Abduction. Abduction, moving the legs away from the midline, prevents the femoral head from dislocating from the newly repaired acetabulum. Question 93. Which of the following factors should be the primary focus of nursing management in a patient with acute pancreatitis? Here are the options. Option A. Nutrition management. Option B. Fluid and electrolyte balance. Option C. Management of hypoglycemia. Option D. Pain control. The correct answer is option D. Pain control. Pain in acute pancreatitis is often excruciating and is a primary focus of management, although fluid resuscitation is also a high priority. Question 94. After a liver biopsy, place the patient in which of the following positions? Here are the options. Option A. Left side lying with the bed flat. Option B. Right side lying with the bed flat. Option C. Left side lying with the bed in semi-Fowler's position. Option D. Right side lying with the bed in semi-Fowler's position. The correct answer is option B. Right side lying with the bed flat. The patient is placed on the right side to allow the weight of the liver to provide pressure on the biopsy site, which helps prevent hemorrhage. Question 95. Which of the following potentially serious complications could occur with therapy for hypothyroidism? Here are the options. Option A. Acute hemolytic reaction. Option B. Angina or cardiac arrhythmia. Option C. Retinopathy. Option D. Thrombocytopenia. The correct answer is option B. angina or cardiac arrhythmia. Thyroid hormone replacement increases the metabolic rate and oxygen demand on the heart, which can precipitate angina or arrhythmias in susceptible patients. Question 96. Adequate fluid replacement and vasopressin replacement are objectives of therapy for which of the following disease processes? Here are the options. Option A. Diabetes mellitus. Option B. Diabetes insipidus. Option C. Diabetic ketoacidosis. Option D. Syndrome of inappropriate antidiuretic hormone secretion SIAD. The correct answer is option B. Diabetes insipidus. Diabetes insipidus is caused by a deficiency in ADH vasopressin. Therapy focuses on replacing fluid and the missing hormone. Question 97. Patients with type 1 diabetes mellitus may require which of the following changes to their daily routine during periods of infection? Here are the options. Option A. No changes. Option B. Less insulin. Option C. More insulin. Option D. Oral diabetic agents. The correct answer is option C. More insulin. Infection increases the body's metabolic demand and stress levels, typically leading to increased blood glucose and a need for more insulin. Question 98. On a follow-up visit after having a vaginal hysterectomy, a 32-year-old patient has a decreased hematocrit level. Which of the following complications does this suggest? Here are the options. Option A. Hematoma. Option B. Hypovolemia. Option C. Infection. Option D. Pulmonary embolus BE. The correct answer is option A. Hematoma. A drop in hematocrit post-surgery often suggests internal bleeding, such as a vaginal or pelvic hematoma. Question 99. A patient has partial thickness burns to both legs and portions of his trunk. Which of the following IV fluids are given first? Here are the options. Option A. Albumin. Option B. D5W. Option C. Lactated Ringer's solution. Option D. 0.9% sodium chloride solution with potassium. The correct answer is option C. Lactated Ringer's solution. Lactated Ringer's is the preferred isotonic solution for initial burn resuscitation as it most closely resembles the electrolyte composition of plasma. Question 100. Which of the following techniques is correct for obtaining a wound culture specimen from a surgical site? Here are the options. Option A. Thoroughly irrigate the wound before collecting the specimen. Option B. Use a sterile swab and wipe the crusty area around the outside of the wound. Option C. Gently roll a sterile swab from the center of the wound outward to collect drainage. Option D. Use a sterile swab to collect drainage from the dressing. The correct answer is option C. Gently roll a sterile swab from the center of the wound outward to collect drainage. Collecting the specimen from the center of the wound using a rolling motion ensures that fresh exudate is captured rather than surface contaminants. Question 101. A nurse is administering Roman IV furosemide to a patient admitted with congestive heart failure. After the infusion, which of the following symptoms is not expected? Here are the options. Option A. Increased urinary output. Option B. Decreased edema. Option C. Decreased pain. Option D. Decreased blood pressure. The correct answer is option C. Decreased pain. Furosemide is a diuretic intended to reduce fluid volume. It is not an analgesic and is not expected to directly decrease pain. Question 102. There are a number of risk factors associated with coronary artery disease. Which of the following is a modifiable risk factor? Here are the options. Option A, gender. Option B, age. Option C, obesity. Option D, heredity. The correct answer is option C, obesity. Obesity is a lifestyle factor that can be modified through diet and exercise, unlike age, gender, or heredity. Question 103. Tissue plasminogen activator TPA is considered for a patient with myocardial infarction. Which of the following is a contraindication for treatment with TPA? Here are the options. Option A, worsening chest pain. Option B, history of cerebral hemorrhage. Option C, history of prior myocardial infarction. Option D, hypertension. The correct answer is option B, history of cerebral hemorrhage. A history of cerebral hemorrhage is a major contraindication for thrombolytics TPA due to the extreme risk of acute intracranial bleed. Question 104. Following myocardial infarction, a hospitalized patient is encouraged to practice frequent leg exercises. Which of the following choices reflects the purpose of exercise for this patient? Here are the options. Option A, increases fitness and prevents future heart attacks. Option B, prevents bed sores. Option C, prevents DVT deep vein thrombosis. Option D, prevent constipations. The correct answer is option C, prevents DVT deep vein thrombosis. Immobility post-MI increases the risk of venous stasis. Leg exercises promote venous return and prevent DVT. Question 105. A patient with myocardial infarction progresses to cardiogenic shock. Which of the following symptoms should the nurse expect? Here are the options. Option A, hypertension. Option B, bradycardia. Option C, bounding pulse. Option D, confusion. The correct answer is option D, confusion. Cardiogenic shock leads to decreased cardiac output and poor brain perfusion, resulting in restlessness, anxiety, or confusion. Question 106. A patient with a history of congestive heart failure arrives at the clinic complaining of dyspnea. Which of the following actions is the first the nurse should perform? Here are the options. Option A, ask the patient to lie down on the exam table. Option B, draw blood for chemistry panel and ABG. Option C, send the patient for a chest X-ray. Option D, check blood pressure. The correct answer is option D, check blood pressure. The first step in assessment for a patient in distress is checking vital signs to determine the severity of the hemodynamic status. Question 107. A clinic patient prescribed nitroglycerin for angina calls complaining of frequent headaches. Which of the following responses is correct? Here are the options. Option A, stop taking the nitroglycerin. Option B, go to the emergency department. Option C, headaches are a frequent side effect because it causes vasodilation. Option D. The headaches are unlikely to be related. The correct answer is option C. Headaches are a frequent side effect because it causes vasodilation. Nitroglycerin causes systemic vasodilation, which frequently results in headaches. This is a common and expected side effect. Question 108. A patient in remission from colon cancer complains of fatigue and difficulty with concentration. Which of the following explanations would account for her symptoms? Here are the options. Option A. The symptoms may be the result of anemia caused by chemotherapy. Option B. The patient may be immunosuppressed. Option C. The patient may be depressed. Option D. The patient may be dehydrated. The correct answer is option A. The symptoms may be the result of anemia caused by chemotherapy. Chemotherapy can cause long-term bone marrow suppression and anemia, which manifests as fatigue and brain fog or difficulty concentrating. Question 109. A clinic patient has a hemoglobin concentration of 10.8 g/dl and reports a strict vegetarian diet. Which nutritional advice is appropriate? Here are the options. Option A. The diet is providing adequate sources of iron. Option B. The patient should add meat to her diet. Option C. The patient should use iron cookware and eat dark green leafy vegetables. Option D. A cup of coffee should be added to every meal. The correct answer is option C. The patient should use iron cookware and eat dark green leafy vegetables. Vegetarians can maintain iron levels by using iron cookware and consuming non-heme iron sources like legumes and leafy greens. Question 110. A patient is receiving patch red blood cells (PRBCS) for severe anemia. Which of the following is the most accurate statement? Here are the options. Option A. Transfusion reaction is most likely after the infusion is completed. Option B. PRBC are best infused through a 20G Roman IV catheter. Option C. PRBC should be flushed with a 5% dextrose solution. Option D. A nurse should remain in the room during the first 15 minutes of infusion. The correct answer is option D. A nurse should remain in the room during the first 15 minutes of infusion. Most hemolytic reactions occur within the first 50 ml of the infusion. Therefore, close monitoring in the first 15 minutes is vital. Question 111. A patient who has received chemotherapy is given an injection of epoetin. Which of the following should reflect the findings in the CBC several days later? Here are the options. Option A. An increase in neutrophil count. Option B. An increase in hematocrit. Option C. An increase in platelet count. Option D. An increase in serum iron. The correct answer is option B. An increase in hematocrit. Epoetin alpha stimulates the production of red blood cells, which is reflected as an increase in hematocrit and hemoglobin. Question 112. A patient is admitted with suspected polycythemia vera. Which of the following symptoms is consistent with the diagnosis? Here are the options. Option A. Weight loss. Option B. Increased clotting time. Option C. Hypertension. Option D. Headaches. The correct answer is option D. Headaches. In polycythemia vera, the blood becomes hyperviscous thick, which frequently causes headaches, dizziness, and visual disturbances. Question 113. A nurse is caring for a patient with a platelet count of 20/microliter. Which of the following is an important intervention? Here are the options. Option A. Observe for evidence of spontaneous bleeding. Option B. Limit visitors to family only. Option C. Give aspirin in case of headaches. Option D. Impose immune precautions. The correct answer is option A. Observe for evidence of spontaneous bleeding. A platelet count below 20,000 puts the patient at high risk for spontaneous, life-threatening bleeding. Question 114. A nurse assesses a patient who has been taking long-term corticosteroids. Which of the following is a typical side effect? Select all that apply. Here are the options. Option A. Hypertension. Option B. Cushingoid features. Option C. Hyponatremia. Option D. Low serum albumin. The correct answer is option B. Cushingoid features. Long-term corticosteroid use leads to Cushingoid features such as a moon face, buffalo hump, and central obesity. Question 115. Which of the following is the most important nursing action when caring for a neutropenic patient? Here are the options. Option A. Change the disposable mask immediately after use. Option B. Change gloves immediately after use. Option C. Minimize patient contact. Option D. Minimize conversation with the patient. The correct answer is option B. Change gloves immediately after use. Strict hand hygiene and changing gloves are the most critical actions to prevent the transmission of pathogens to an immunocompromised patient. Question 116. A nurse teaches family members about infectious precautions for a leukemia patient. Which statement indicates the family needs more education? Here are the options. Option A. We will bring in books and magazines. Option B. We will bring in personal care items. Option C. We will bring in fresh flowers to brighten the room. Option D. We will bring in family pictures. The correct answer is option C. We will bring in fresh flowers to brighten the room. Fresh flowers and plants are prohibited for neutropenic patients because they can harbor mold and bacteria, e.g., Pseudomonas. Question 117. A nurse is caring for a patient with acute lymphoblastic leukemia, all. Which of the following is the most likely age range of the patient? Here are the options. Option A. 3-10 years. Option B. 25-35 years. Option C. 45-55 years. Option D. Over 60 years. The correct answer is option A. 3-10 years. All is the most common type of leukemia in children, with the peak incidence occurring between ages 3 and 10. Question 118. A patient is admitted for diagnosis of suspected Hodgkin's disease. Which of the following symptoms is typical of Hodgkin's disease? Here are the options. Option A. Painful cervical lymph nodes. Option B. Night sweats and fatigue. Option C. Nausea and vomiting. Option D. Weight gain. The correct answer is option B. Night sweats and fatigue. Hodgkin's disease often presents with B symptoms, which include drenching night sweats, fever, fatigue, and unexplained weight loss. Question 119. If the diagnosis of Hodgkin's disease were correct, which of the following cells would the pathologist expect to find in a lymph node biopsy? Here are the options. Option A. Lymphoblastic cells. Option B. Reed-Sternberg cells. Option C. Butcher's cells. Option D. Reeder's cells. The correct answer is option B. Reed-Sternberg cells. The presence of Reed-Sternberg cells, large, multinucleated cells, is the definitive diagnostic marker for Hodgkin's disease. Question 120. A patient is about to undergo bone marrow aspiration and biopsy and expresses fear. Which of the following is the most effective nursing response? Here are the options. Option A. Warn the patient to stay very still. Option B. Encourage the family to stay in the room. Option C. Stay with the patient and focus on slow, deep breathing. Option D. Delay the procedure. The correct answer is option C. Stay with the patient and focus on slow, deep breathing. Staying with the patient and providing distraction or relaxation techniques like deep breathing is the most effective way to manage procedural anxiety. Question 121. A client with bacterial pneumonia is admitted to the pediatric unit. What would the nurse expect the admitting assessment to reveal? Here are the options. Option A. High fever. Option B. Non-productive cough. Option C. Rhinitis. Option D. Vomiting and diarrhea. The correct answer is option A. High fever. Bacterial pneumonia in children usually presents with a sudden onset of high fever, along with a productive cough and respiratory distress. Question 122. The nurse is caring for a client admitted with epiglottitis. Because of the possibility of complete obstruction of the airway, which of the following should the nurse have available? Here are the options. Option A. Intravenous access supplies. Option B. A tracheostomy set. Option C. Intravenous fluid administration pump. Option D. Supplemental oxygen. The correct answer is option B. A tracheostomy set. Epiglottitis is a medical emergency. The nurse must have emergency airway equipment, tracheostomy or intubation set at the bedside in case of sudden closure. Question 123. A 25-year-old client with Graves' disease is admitted to the unit. What would the nurse expect the admitting assessment to reveal? Here are the options. Option A. Bradycardia. Option B. Decreased appetite. Option C. Exophthalmos. Option D. Weight gain. The correct answer is option C. Exophthalmos. Exophthalmos, bulging of the eyes, is a classic finding in Graves' disease caused by inflammation of the extraocular muscles and fatty tissue behind the eye. Question 124. The nurse is providing dietary instructions to the mother of an 8-year-old child diagnosed with celiac disease. Which food selection indicates understanding of the instructions? Here are the options. Option A. Ham sandwich on whole wheat toast. Option B. Spaghetti and meatballs. Option C. Hamburger with ketchup. Option D. Cheese omelette. The correct answer is option D. Cheese omelette. Celiac disease requires a gluten-free diet. Eggs and cheese are naturally gluten-free, whereas wheat toast and pasta contain gluten. Question 125. The nurse is caring for an 80-year-old with chronic bronchitis. Upon finding an O2 set of 76%, which of the following actions should the nurse take first? Here are the options. Option A. Notify the physician. Option B. Recheck the O2 saturation level in 15 minutes. Option C. Apply oxygen by mask. Option D. Assess the pulse. The correct answer is option D. Assess the pulse. When a monitor shows a critically low value 76%, the nurse must first assess the patient's physical status pulse/circulation to determine if the reading is accurate or if the patient is in distress. Question 126. The doctor performs an amyotomy on a gravida 3 para 0. Which observation would the nurse be expected to make after the amyotomy? Here are the options. Option A. Fetal heart tones 160 bpm. Option B. A moderate amount of straw-colored fluid. Option C. A small amount of greenish fluid. Option D. A small segment of the umbilical cord. The correct answer is option B. A moderate amount of straw-colored fluid. Normal amniotic fluid is clear or straw-colored. Greenish fluid indicates meconium staining, and a cord segment indicates a prolapsed cord emergency. Question 127. The client is 2 cm dilated. Which of the following statements would the nurse expect her to make? Here are the options. Option A. We have a name picked out for the baby. Option B. I need to push when I have a contraction. Option C. I can't concentrate if anyone is touching me. Option D. When can I get my epidural? The correct answer is option A. We have a name picked out for the baby. In the latent/early phase of labor-3C, clients are typically excited, talkative, and oriented toward future plans for the baby. Question 128. The client is having fetal heart rates of 90-110 bpm during the contractions. The first action the nurse should take is, here are the options. Option A. Reposition the monitor. Option B. Turn the client to her left side. Option C. Ask the client to ambulate. Option D. Prepare for delivery. The correct answer is option B. Turn the client to her left side. Fetal bradycardia during contractions suggests decreased placental perfusion. Turning the client to the left side maximizes blood flow to the uterus. Question 129. In evaluating the effectiveness of Roman 4 pitocin for a client with secondary dystocia, the nurse should expect, here are the options. Option A. A painless delivery. Option B. Cervical effacement. Option C. Infrequent contractions. Option D. Progressive cervical dilation. The correct answer is option D. Progressive cervical dilation. The therapeutic goal of pitocin oxytocin in labor is to produce effective contractions that lead to progressive cervical dilation. Question 130. A vaginal exam reveals a fulling breech presentation. The nurse should take which of the following actions? Here are the options. Option A. Anticipate the need for a cesarean section. Option B. Apply the fetal heart monitor. Option C. Place the client in genupectoral position. Option D. Perform an ultrasound exam. The correct answer is option A. Anticipate the need for a cesarean section. A footling breech carries a high risk of umbilical cord prolapse during labor, often necessitating a cesarean section for safe delivery. Question 131. A vaginal exam reveals the cervix is 4 cm dilated, membranes intact, and FHR 160-170 bpm. What is the rationale for applying an external fetal monitor? Here are the options. Option A. The cervix is closed. Option B. The membranes are still intact. Option C. The fetal heart tones are within normal limits. Option D. The contractions are intense enough for an internal monitor. The correct answer is option B. The membranes are still intact. Internal monitoring scalp electrode requires ruptured membranes. Because the membranes are intact, an external monitor is the appropriate choice. Question 132. Which nursing diagnosis would be most appropriate for the prima gravida as she completes the early phase of labor? Here are the options. Option A. Impaired gas exchange. Option B. Alteration in placental perfusion. Option C. Impaired physical mobility. Option D. Potential fluid volume deficit. The correct answer is option D. Potential fluid volume deficit. Clients in labor are often NPO or have limited intake while expending significant energy, making them at risk for fluid volume deficit/dehydration. Question 133. At 8 cm dilation, the nurse notes late decelerations and a baseline of 165-175 ppm. What is the most likely explanation? Here are the options. Option A. The baby is asleep. Option B. The umbilical cord is compressed. Option C. There is a vagal response. Option D. There is uteroplacental insufficiency. The correct answer is option D. There is uteroplacental insufficiency. Late decelerations are a non-reassuring sign caused by uteroplacental insufficiency, meaning the fetus is not receiving enough oxygen during contractions. Question 134. The nurse notes variable decelerations on the fetal monitor strip. The most appropriate initial action would be to. Here are the options. Option A. Notify her doctor. Option B. Start enrollment for. Option C. Reposition the client. Option D. Readjust the monitor. The correct answer is option C. Reposition the client. Variable decelerations indicate umbilical cord compression. Changing the mother's position is the first step to relieve pressure on the cord. Question 135. Which of the following is a characteristic of a reassuring fetal heart rate pattern? Here are the options. Option A. A fetal heart rate of 170-180 bpm. Option B. A baseline variability of 25-35 bpm. Option C. Ominous periodic changes. Option D. Acceleration of FHR with fetal movements. The correct answer is option D. Acceleration of FHR with fetal movements. Accelerations of the fetal heart rate in response to fetal movement are a positive, reassuring sign of fetal well-being. Question 136. The rationale for inserting a French catheter every hour for the client with epidural anesthesia is: here are the options. Option A. Bladder fills more rapidly. Option B. Patient is in a trance-like state. Option C. The sensation of the bladder filling is diminished. Option D. Patient is embarrassed to ask for a bedpan. The correct answer is option C. The sensation of the bladder filling is diminished. Epidural anesthesia blocks sensory nerves, meaning the client may not feel the urge to void, which can lead to bladder distension and impede labor. Question 137. A client asks about the most likely time for her to conceive. The nurse explains that conception is most likely to occur when. Here are the options. Option A. Estrogen levels are low. Option B. Luteinizing hormone is high. Option C. The endometrial lining is thin. Option D. The progesterone level is low. The correct answer is option B. Luteinizing hormone is high. A surge in luteinizing hormone LH triggers ovulation, which is the most fertile window for conception. Question 138. The nurse is aware that the success of the rhythm method of birth control depends on the. Here are the options. Option A. Age of the client. Option B. Frequency of intercourse. Option C. Regularity of the menses. Option D. Range of the client's temperature. The correct answer is option C. Regularity of the menses. The rhythm method fertility awareness relies on the regularity of the menstrual cycle to predict the window of ovulation. Question 139. Which method of birth control is most suitable for the client with diabetes? Here are the options. Option A. Intrauterine device. Option B. Oral contraceptives. Option C. Diaphragm. Option D. Contraceptive sponge. The correct answer is option C. Diaphragm. Diaphragm's barriers are often preferred for diabetics because they do not affect blood glucose unlike hormones or increase infection risk unlike EIDs. Question 140. The doctor suspects that the client has an ectopic pregnancy. Which symptom is consistent with this diagnosis? Here are the options. Option A. Painless vaginal bleeding. Option B. Abdominal cramping. Option C. Throbbing pain in the upper quadrant. Option D. Sudden stabbing pain in the lower quadrant. The correct answer is option D. Sudden stabbing pain in the lower quadrant. An ectopic pregnancy, especially if ruptured, typically presents as a sudden, sharp stabbing pain in one of the lower abdominal quadrants. Question 141. Which menu selection will best meet the nutritional needs of the pregnant client? Here are the options. Option A. Hamburger patty, green beans, French fries, and iced tea. Option B. Roast beef sandwich, potato chips, baked beans, and cola. Option C. Baked chicken, fruit cup, potato salad, coleslaw, yogurt, and iced tea. Option D. Fish sandwich, gelatin with fruit, and coffee. The correct answer is option C. Baked chicken, fruit cup, potato salad, coleslaw, yogurt, and iced tea. Selection C provides a balanced mix of lean protein, calcium yogurt, and vitamins from fruit, which are essential for fetal development. Question 142. The client with hyperemesis gravidarum is at risk for developing. Here are the options. Option A. Respiratory alkalosis without dehydration. Option B. Metabolic acidosis with dehydration. Option C. Respiratory acidosis without dehydration. Option D. Metabolic alkalosis with dehydration. The correct answer is option D. Metabolic alkalosis with dehydration. Excessive vomiting hyperemesis leads to a loss of gastric hydrochloric acid, resulting in metabolic alkalosis and severe fluid volume deficit. Question 143. The most definitive sign of pregnancy is. Here are the options. Option A. Elevated human chorionic gonadotropin. Option B. The presence of fetal heart tones. Option C. Uterine enlargement. Option D. Breast enlargement and tenderness. The correct answer is option B. The presence of fetal heart tones. Fetal heart tones, fetal movement felt by a provider, and ultrasound visualization are positive or definitive signs of pregnancy. Question 144. The nurse is caring for a neonate whose mother is diabetic. The nurse will expect the neonate to be. Here are the options. Option A. Hypoglycemic, small for gestational age. Option B. Hyperglycemic, large for gestational age. Option C. Hypoglycemic, large for gestational age. Option D. Hyperglycemic, small for gestational age. The correct answer is option C. Hypoglycemic, large for gestational age. Maternal hyperglycemia leads to fetal hyperinsulinism. After birth, the insulin remains high but the glucose supply is cut, causing hypoglycemia in a large for gestational age LGA baby. Question 145. Which instruction should be included in the nurse's teaching regarding oral contraceptives? Here are the options. Option A. Weight gain should be reported to the physician. Option B. An alternate method of birth control is needed when taking antibiotics. Option C. Take 2 pills per day for 1 week if a dose is missed. Option D. Changes in menstrual flow should be reported to the physician. The correct answer is option B. An alternate method of birth control is needed when taking antibiotics. Certain antibiotics can decrease the effectiveness of oral contraceptives by altering gut flora, so backup barrier methods are required. Question 146. Breastfeeding is contraindicated in the postpartum client with. Here are the options. Option A. Diabetes. Option B. Positive HIV. Option C. Hypertension. Option D. Thyroid disease. The correct answer is option B. Positive HIV. In developed countries, HIV is a contraindication to breastfeeding because the virus can be transmitted to the infant through breast milk. Question 147. A client is admitted with vaginal bleeding and very little discomfort. The nurse's first action should be to. Here are the options. Option A. Assess the fetal heart tones. Option B. Check for cervical dilation. Option C. Check for firmness of the uterus. Option D. Obtain a detailed history. The correct answer is option A. Assess the fetal heart tones. Painless vaginal bleeding suggests placenta previa. The priority is to assess fetal well-being FHR before any other interventions. Question 148. The nurse should tell the client that labor has probably begun when. Here are the options. Option A. Her contractions are 2 minutes apart. Option B. She has back pain and a bloody discharge. Option C. She experiences abdominal pain and frequent urination. Option D. Her contractions are 5 minutes apart. The correct answer is option D. Her contractions are 5 minutes apart. Regular contractions that occur at consistent intervals, for example every 5 minutes, and increase in intensity are a sign of true labor. Question 149. Which characteristic is associated with babies born to mothers who smoked during pregnancy? Here are the options. Option A. Low birth weight. Option B. Large for gestational age. Option C. Preterm birth, but appropriate size. Option D. Growth retardation in weight and length. The correct answer is option A. Low birth weight. Nicotine causes vasoconstriction of the placental vessels, which reduces the supply of oxygen and nutrients, leading to low birth weight.